Hello, and welcome to today's episode of the GynoBits podcast. I'm your host, Dr. Susie Weber, board-certified gynecologist and menopause specialist. On the GynoBits podcast, we'll cover women's health issues with a focus on menopause, vulvovaginal conditions, and sexual health. Hello, everyone. Today, I wanted to talk about a new medication that's been approved by the FDA to treat menopausal hot flashes. And this is pretty exciting because there hasn't been anything new that's come down the pipe in a long time. The medication is called Fezolinetant, and it's a non-hormonal medication. So it's going to be a treatment option for women who can't or do not want to take hormonal therapy to treat their hot flashes and night sweats. Menopausal hot flashes affect up to 80% of women, and for some women they're mild and not bothersome, but for some they are moderate to severe and can be very disrupting to sleep, to daily activities, quality of life, you name it. Some women will be able to modulate their hot flashes through lifestyle interventions such as diet and exercise. And some women will prefer to use hormonal therapy once they've discussed the risks and benefits with their physician. But for women with hormonally sensitive cancers or higher risk medical conditions such as having had a history of a stroke or a blood clot, or if they simply don't want to be on hormones, maybe they have a strong family history of breast cancer or they have some other reason to not be on hormones, this provides another non-hormonal effective option. The only other FDA-approved non-hormonal option is something called Brisdel, and it's paroxetine or Paxil. It's an antidepressant that women can take, which has been shown to reduce hot flashes, but not to the degree that other medications that we use off-label and hormones work. On average, hormonal therapy will reduce hot flashes and night sweats, what we call vasomotor symptoms, by about 75%. I've seen it quoted in studies anywhere from 65 to 90%. Something like Brisdel or Paxil, paroxetine will decrease hot flashes by about 40%. And then there are other medications in the SSRI and SNRI families such as venlafaxine, which will reduce hot flashes by about 60%. This new medication, Fezolinetant, is what we call an NK3 receptor antagonist, and it works by blocking neurokinin B in our hypothalamus, or our temperature control center in our brain, to reduce the number and intensity of hot flashes. Before menopause, when we have higher levels of estrogen, there's a balance between estrogen and neurokinin B, but as our estrogen levels decline, this balance becomes upset, and so our brains react erratically to smaller changes in our temperature. Fezolinetant blocks neurokinin B in our brain from binding to a group of neurons called KNDy neurons, kisspeptin, neurokinin B, dynorphin neurons. Keeps these neurons from being overstimulated and producing these vasomotor symptoms. Fezolinetant is a once daily 45 milligram pill that you can take with or without food, and it generally should be taken about the same time every day. It is contraindicated in women that are taking certain medications and in women that have liver disease or kidney damage or end-stage kidney disease. The most common adverse or side effects were abdominal pain, insomnia, back pain, hot flushing, that's funny, diarrhea, and elevated hepatic transaminases or elevated liver enzymes. The percentage of women in which these side effects occurred was quite low. The most common side effect was abdominal pain in the treatment group, 4.3% versus 2.1%. So all of these adverse effects occurred in women that were also taking the placebo medication as well. For example, elevated liver function tests occurred in women taking placebo about 0.8% of the time, and it occurred about 2.2% of the time in women taking the study medication. But because of this elevation in liver enzymes, it is recommended that women undergo testing prior to starting the medication, so to get a baseline level of their liver function tests to make sure that they are still a candidate for the medication. And then they are supposed to follow up at 3, 6, and 9-month intervals to repeat these blood tests to make sure that there is no elevation in their liver enzymes. Fortunately, in the study, women that had elevated liver enzymes were asymptomatic. They didn't have any symptoms of this, and when they stopped the medication, the levels went back down to normal. So there didn't appear to be any long-term effects from this. Some of the common medications that would keep a woman from being a candidate for using Fezolinetant include cimetidine, which is a reflux medication, ciprofloxacin, which is an antibiotic, ethinyl estradiol, which is the estrogen that is in our birth control pills, fluvoxamine, which is an SSRI or a medication used to treat mood and other disorders. The studies on the medication were conducted in the United States, Canada, and Europe and involved over 3,000 women. The studies were called Bright Sky, and there were 3 studies conducted over a year or 52 weeks. Women in the studies ranged in age from 40 to 65. The studies looked at efficacy over 12 weeks and was a double-blind, placebo, randomized clinical controlled trial. Then the study was extended up to 52 weeks to look at safety. The primary outcomes they were looking at were the mean change from baseline hot flashes at 4 weeks being on the medication and 12 weeks of being on the medication as compared to taking placebo. The other outcome was whether the medication reduced the severity and intensity of hot flashes. The first trial, Bright Sky 1, had 174 women in the Fezolinetant group and 175 women in the placebo group. And what they found was that at 4 weeks, there was a reduction in hot flashes from a baseline of 10.4 hot flashes per day down by more than 5 hot flashes per day. In the placebo group, hot flashes were reduced between 3 and 4 per day. So that's why, of course, it's always so important to compare our medications or intervention to placebo, because a lot of studies have a huge placebo effect. Both of the groups were having moderate to severe hot flashes to the tune of 10 or 11 daily. And at the end of 3 months or 12 weeks, the Fezolinetant group had between 2 and 3 fewer severe hot flashes per day than the placebo group. And I'm kind of a skeptic, so at first I didn't feel like this was too impressive, but if that's 2 times a night that you are waking up with night sweats and you can't get back to sleep, or it's twice in your workday that you have to stop and you can't complete the task at hand, or you are stripping down your layered clothing, that can be pretty significant. It was shown to be statistically significant in the study, of course, that's why this medication is being approved. But on a daily basis, this could definitely be something significant for a woman going through this vasomotor roller coaster ride on a daily basis. In the second efficacy trial, the Bright Sky 2, findings were similar. In this group, women were having between 11 and 12 moderate to severe hot flashes daily, and by the end of 12 weeks, there was a reduction by 2 to 3 significant hot flashes in the medication group as opposed to the placebo group. Both studies also showed that there was a reduction in the intensity of these hot flashes as well. And as I mentioned, the study had women between the ages of 40 and 65. They had to be having on minimum an average of about 7 moderate to severe hot flashes daily. The mean age in the study was about 54, and it did have women from multiple racial backgrounds. There were 81% Caucasian, 17% African American, 24% Latina, and 1% Asian women in the study. Women had to be menopausal and have one or more of the following: having had a hysterectomy, prior removal of ovaries, and prior hormone therapy with a washout period. Interestingly, they also looked at sleep improvement, but this was not shown to be statistically significant, although they did show sleep improvement in a lot of the participants. So to recap, Fezolinetant is a new FDA-approved non-hormonal treatment option for moderate to severe menopausal vasomotor symptoms, hot flashes. It works through neurons in our hypothalamus, the area of our brain that controls our body temperature. It's a once daily pill, oral medication. It is not to be taken by women using certain medications or who have liver disease or kidney disease. It reduced hot flashes from baseline over placebo by an additional 2 to 3 hot flashes daily. It reduced the severity or intensity of hot flashes. Elevated liver enzymes were observed in more women on the medication. However, once they stopped the medication, there was no long-term effects. But the medication does require a baseline liver enzyme test and periodic monitoring at 3, 6, and 9 months of medication use. Right now we have about 52 weeks of safety data, so we'll really need to see what happens once the medication starts getting prescribed to see if there are other good or bad things that emerge from more and more women using these medications. Right now, it looks like the price tag on the medication is about $550 a month, but hopefully insurers will start to cover this medication. Plus, the company making the medication generally will have some support programs in order to offset these costs initially. There's also another similar medication in the pipeline in the same family, so we will see what happens if we get other medications such as this coming to market soon. But it's certainly exciting to have new tools in our toolbox to combat some of these bothersome menopausal symptoms. And again, also provides another option for women who cannot take hormones or don't want to take hormones. But some questions that linger in my mind are, how long will we want these women to be taking these medications? And what will it be like stopping these medications? I'm wondering if there'll be any kind of withdrawal symptoms or exacerbation of vasomotor symptoms when stopping these medications. And it will be interesting to see if there are any other potential benefits from these medications, especially if we start to see an improvement in sleep, because a lot of times sleep can be disordered regardless of hot flashes and night sweats in the midlife and as we age. Guess we just all need to stay tuned to see what further outcomes will be emerging. Thanks for listening. I hope you enjoyed today's podcast. I'll see you next week. Thank you for joining me for today's GynoBits podcast. If you like this podcast, please like, subscribe, and share. Just a reminder that this is not medical advice and you should consult with your personal physician. Also, the opinions and views are mine only and do not reflect those of my employer. If you would like more information or to consult with me, please go to my webpage, healthiermenopause.com. You can also find me on Instagram at Healthier Menopause and Facebook, Menopause MD.